We're going to have a pretty fast-moving program, and there may be others, obviously, that will come in. So I'm going to do the best I can to explain how we're going to be moving along. I appreciate you coming. This is designed for the Health and Personal Ministries leaders. We recognize that God has called us to spread the gospel. We recognize that we've been told that the health is the right arm of the message. That's how Christ met people's felt needs. We recognize that personal ministries is following the admonition of Acts chapter 1 that plainly says that the church is God's tool for spreading the gospel. Well, the church is you. And so we recognize that we have been called, yes, for health, yes, to make people's lifestyles change and to improve, but we're also talking about the gospel as far as salvation and eternity is concerned. Just two different verses I wanted to lead you to, if you want to say it that way. One is Jeremiah 33:3, where it says what? He says, and by the way, Jeremiah was in prison when the Lord told him, he said, "Call upon me, and I will answer you." And then he said, "I'm going to do things for you." Basically, that you wouldn't believe. It's the same thing he told Habakkuk in Habakkuk chapter 1. So as we come here this afternoon and talk about a lot of different ways and directions we can go, we're not going to go anything without the Lord and the Holy Spirit guiding us. So folks, I hope that we can remember that text. What He's promised, He will do. And when He says, "Call upon me," that's what He means. We may think we're talented, we may think we're gifted, and we may be. But we're nowhere without the power of the Holy Spirit. And then the other text I would suggest would be Isaiah chapter 60, where it says, "Arise and shine." For what? For thy light has come, and the light is what? The Lord. So the call is made, and folks, we're reminded in the little book Steps to Christ that every day we should give our will and plans to the Lord. And folks, this is the way that those messages will be carried out. Let's bow our heads for prayer. Father in heaven, I thank you for each man and woman here this afternoon that has come out and braved this weather. They did not have to come. But Lord, they have responded to your call to reach out with your right arm to spread the health message in various ways. They've responded in the call to personal ministries, ministering personally to people. And Lord, we're reminded with these two texts that you will work through us if we allow you to, and if we will give you our will and our plans every day. So Lord, I ask that you'll bless us this afternoon as we look at a lot of different things that we can use, things that maybe we cannot, things that you can show us to do, or things we shouldn't do. So bless all of our efforts. We thank you in the name of Jesus. Amen. Very quickly, as far as the folder that you have, and did I leave mine over there, Pam? I had the folder right there. Well, yeah, that's fine. Either anymore. Just very quickly, a few years ago, Dr. Handysides at the General Conference gave me a 90 DVDs in health. Well, you can't go 90 different directions. What we're going to do, as you look at your folder, I'm going to just quickly show you a few things, but basically the information is there for you. Now, we are filming this program. It will be on the conference website. So because of that, we're not going to be able to take questions. The questions are going to have to be at the end. So if you have questions on any speaker today or subject, maybe write it down so you can keep an eye, remember whatever the question was. Let me just draw your attention very quickly to the left side, dealing with health. You can see the green sheet. Here's got a lot of suggestions. One of the main suggestions I would say, if you do not have a committee, and this is the first time you've been a health leader, bring some people together. Ask the church board to give you some help, some variety even, that can help you. Same thing in personal ministries. On personal ministries, on the right-hand side, your sheet is a blue sheet, which is down a little bit farther. On these two handouts are recommendations for types of, for numbers maybe, or for putting your committee together. Something I would simply say for both categories, and I usually say this every year, there's 4 things, and it's listed there, but it's 4 things to remember. Number 1, besides obviously starting with prayer and the spiritual commitment, but we're talking about, first of all, you've got a plan. Long-range plans, short-range plans. Secondly, as the leader and with your assistants and your committee, you've got to organize to carry out the plans. Third, you've got to be able to manage the organizational plans. And fourth, evaluate what you've done. I suggest that we do those 4 things in both categories, health or personal ministries. Sometimes we do the same thing over and over and over. We need to evaluate it. You may be gifted as a planning, but you may not be gifted as an organizing person. Or you might be great at organizing, but you can't manage. Make sure you've got people in your committee that can help you, okay? Now, on the left-hand side, following the green sheet is it's about 3 sheets dealing with the Instep for Life program. We've been doing this now for about 20 years. Why? Well, we don't stop because God expects this temple, His temple, to be kept in good shape. And so we talk 3 things in this conference. Aerobic exercise, improving your heart, your lungs. And so there's plans that are listed there. Following that, we talk about strength training, something we never talk about. We have 63 major muscles. Well, if they're in good shape, it's going to be less effort. The muscles in your leg, pull your legs forward. Your leg doesn't just move. It contracts and pulls forward. If the legs are in good shape, it's going to take less effort. So we need to talk about that. And we have a plan for strength training, and there's suggestions right there. I'm 77 years old, but I lift weights. I do 150 push-ups a week, 400 sit-ups. Why do I do that? I want to keep what I've got in good shape. And so, and then you'll see a section there on flexibility, okay? And then after that, we are going to begin in just a few moments going through the speakers, and we're not going to go through the rest of that folder. I will say the next one there on the Instep for Life Day, that used to be the Let's Move Day. We've changed the title of that now, but you can do whatever you want. Some churches call it a Kids Fun Day, something that reaches out to the kids in the community to get them active physically. Now, on the right-hand side, under personal ministries, both sides need to look at that a moment. That white sheet is a schedule of upcoming seminars, either in health or personal ministries. You can read, so I'm not going to go down through there on that. The only change, I believe, in there maybe is the diabetes reversal seminar that was scheduled in Atlanta March 1 and 2. I think he has had to change that, so we'll have to let you know on that date a little bit later. The blue sheet gives you the same kind of information I was just talking about, and I believe that then the next sheet there, it talks about our different ways that we can communicate with you. The communique comes out every 2 months. The e-communique comes out every week. And we have our website. The North American Division has a website. Now, the NAD and the Southern Union has a website for health and personal ministries. Interesting. Both NAD and Health and Personal Ministries are showing the videos from the recent NAD convention in Albuquerque. So if it's not there, it will be. You can see everything that went on. In personal ministries, very interesting. They are set up now to take videos from people all over North America. And even if you're doing something interesting, for example, Stanford Gap just had their food distribution program filmed by 3ABN. So that will probably be on there. So I just wanted you to be alert to that. All right, we're going to start down through here right now. Our first person to speak is Pam Knechtel from the Stanford Gap Church. She's the evangelism coordinator, and she's going to tell you some things that's been happening there that are good suggestions for us to follow in our church.
Hi. Happy Sabbath. So EW wanted me to share with you what has been happening at Stand Up for Gap. And we just had a ministry fair. We invited our church members to come to the ministry fair. We wanted to show them what was going on in their church. A lot of times we go to church and we have no clue really what's going on and how to get involved. And we're working on total member involvement in our church. So I believe that the inspiration from this ministry fair idea came from our new pastor, David Sittler. And he asked us the question, the leadership in the church, the question, where do you see God already at work in your church? And wow, our leadership teams began brainstorming, and we caught a vision as to what it would be like if we all worked together instead of independently. And so I'll just describe what I saw happening, and I'm still blown away at the Holy Spirit explosion that's going on in our church. We have a baby shower ministry there, and they provide boxes with baby items, and they give them to young couples in our church that are having new babies. And they all have brand new blankets in them and other wonderful baby items. But what happened is our baby shower ministry leader said, well, you know what? I could provide baby shower item boxes for our manna, which is our pantry. And so on Tuesdays and Thursdays, we have a pantry at our church, and we provide food to probably 200 people, less fortunate people a week that are coming from our community. And so, you know, there's also a need for the young couples that are having babies in the neighborhood that are, they're having babies and they don't have the items that they need. So she said, okay, well, let me provide boxes for the manna, which is our pantry. And at that point, we realized that we're going to run out of blankets. And so a blanket ministry was created, and now we have a team of people that are crocheting and knitting and quilting and tying blankets. And so they not only are supplying now blankets for the baby shower and the manna, but they are also providing blankets for our ministry to the homeless downtown in Chattanooga. And so, and also the overripe bananas that come into the pantry that we didn't get rid of, you know, they can't stay there for weeks and weeks, you know, bananas. So a banana bread ministry was created, and now we have a team of people that are turning the bananas into little loaves of luscious banana bread. And so catch my drift here of where I'm going with this, because we're talking about this ministry feeds up this ministry, feeds up this ministry, and we're cooperating together. So the banana bread ministry is creating all these wonderful loaves of bread and muffins and things. At Christmas time, we took 100 loaves of bread out to our neighbors in our community, and we knocked on their doors and we gave them the bread. Also, we are working with our Glow Tract ministry. And our Pathfinders are using the bread to take to with our shut-in ministry people. And our school kids, of course, are doing the same thing. Anybody that wants any little loaf of bread to take to someone, a neighbor or whatever, you know, we provide that for them. Our health ministry leader, he has came up with a survey to take to the folks that are coming to, the clients that are coming to the manna, our pantry, whereby, you know, we've seen that food is just not all that they need. And so he's put together a survey so that we can provide things for them like addiction recovery, non-smoking, recovery, reversing diabetes and heart disease and things like that. And so people are like checking off all the things that they're needful. of, and we're going to provide programs for them, even English-speaking programs, because we have a lot of Spanish-speaking people that come up to our pantry. And what else has happened? Oh my goodness, it's just an explosion of ministries. And when we, yes, sir. And then, so when we mentioned to our church that we want to have this ministry fair and we want to showcase all your ministries, and I want to know, what you're doing. I mean, I knew what they were doing, but I wanted other people to know what they were doing, and I wanted them to buy in. So when that happened, we ended up with like 27 ministries, and we're a small church. Stand Up for Gap probably has, at the most, maybe 200, 225 people on the Sabbath. Okay, you had a question?
So tell them, well, you just touched on it. Tell them how you did that in the gymnasium. You had a meal, and then what? You had people go around and, and sign up? What did they do?
Yeah, so we had it in our gym. We planned it on Potluck Sabbath, and we had it in our gym across the street from the church. And every one of the ministries that signed up had a 6-foot table, and they could just put their display on. And it was so crazy because people would come in and they could just walk all around and look at all the ministries. Of course, each one was recruiting people because we're trying to get total member involvement. And so, but we had 150 people that day at our potluck. It was phenomenal. And so people are interested, they're hungry to find out, what's going on. And so everybody was recruiting people. And on top of all of that, I just want to say that ministries people are just coming up to us and saying, I've got this idea for ministry. I've got this idea for ministry. Let's do this or let's do that. And we have a handyman ministry that has just recently been started. People are just being so creative. Even our potluck people, that day that we had the potluck and people came to the ministry fair, our potluck leader came up to me and she said, potluck is a ministry because, she said, doing dishes is a ministry. And I said, yeah, it certainly is, So what we're trying to do is we're just want everybody to see that there's something there for them to do and to get involved in ministry.
Well, thank you, Pam. That's exactly what I want you to say. Because this is something really, as an ideal for every church to do. I was there. I was impressed. I mean, the whole gym was set up with booths, and people were going around looking at the posters they had and all kind of things. So you have a final comment? I know she's got to go to another meeting. And
I do have a final comment. We are building community at Stand Up for Gap, one friendship evangelism contact at a time. Amen. It may take you just a few weeks, or it may take you, a few years, but please just continue to work with people. I go to Armana on Tuesdays and Thursdays, and I just give out hugs and tracts sometimes.
What is your manna?
The manna is the pantry.
Okay.
Yep. And I just give out hugs and tell people, let them know I love them. And I'm doing 5 Bible studies right now with people that come up to the pantry. And today I'm running because we're having Bible instructor training over at our church. It's a conference program. You might want to ask somebody about it. But so we're training our church members that are interested to do Bible studies, and they're training today. So this was an amazing experience, and I'm still like totally over the moon over it. So give it a try, you guys. And should I give them my number?
You can do that. I would do that if you'd like to call her for some ideas. Yeah, give it to them right now. 989-942-7604. And my email address is grateful, GRATEFUL, 1995. That was the year I was baptized, at yahoo.com. God is good, y'all. Yeah, that phone number sounds like a Yankee number, but it will work.
I did say y'all, didn't I? I'm getting it. I've been here 6 years, so I'm getting it.
Thank you, Pam.
Love you guys.
Just hand that to somebody. I don't know who over there.
Who's next?
Okay, next will be Light Ministry, if y'all can come on up. Folks, don't take that lightly. because I go all over this conference with personal ministries and adult ministries. I don't guess I identified myself. Anybody, I think everybody knows I'm E.W. Dempsey, so it doesn't matter. But the point is, that's a tremendous idea. The next people we've got here is Light Ministry, and this is Karen with a C. And she's going to tell you all about Light Ministry and how this can work in your church. And her husband Ron is here with her too. Thank you.
You want to use this? Okay. It's hard to triple duty here, but I'll do it. My name is Karen Lynch. My husband Ron and I are the North American Division Directors for Light Ministry. I'm not sure if you're familiar with Light Ministry, but I'm going to give you a little overview of how Light came into existence since 2008 and what we do and how we can help your church with health evangelism. We do have a flyer in the welcome packet. So if you'll see that, it's on the left-hand side. It is, you can take a look at this after. This is going to give you kind of an overview of what trainings we can come to your church to, facilitate for your membership. We don't charge anything to come, so that's always a good thing, other than our transportation, and obviously if you're far enough away, we may need some accommodations and a little food. But other than that, we are there to meet the needs of your church. So we're going to do a little overview here. And, all right. So Light is a supporting ministry of the Seventh-day Adventist Church. We are ASI members as well as OCI members. Many of you know ASI, the Adventist Layman's Services and Industries, and then some of you may know about OCI. OCI is the Outpost Centers International. And Outpost Centers International really nurtures ministries that are doing God's work wherever in the world. They're part of ASI as well. So we grew out of a movement at Wildwood. Now, Wildwood is not only a lifestyle center, if you're familiar with Wildwood's lifestyle center, but Wildwood is also a college of health evangelism. And during the early 2000s, there was really a lot of discussion on how they could take health evangelism and medical missionary training to the world. You know, we are so blessed here in this area because we have multiple Heartland, Uchee Pines, even going as far as California, Weimar, Eden Valley, and of course Wildwood, to train people to do health evangelism and medical missionary work. However, we know that there's a whole world out there of people who need this training. So what happened was a group of people got together and said, we need to take this training to the world. So Light was founded then. It's called the Lay Institute for Global Health Training. So what we do is we've condensed the health evangelism program. It's called the Essentials of Health Evangelism. And what we do is we go all over the world and we do 125-hour training. But what we do here in the United States is just a little different because we happen to have these training schools right here. So we're going to tell you a little bit about that. By the way, that is our director and his wife, James Hartley, and his wife, Danny. You know, there's so many miracles that we've seen over the course of doing missionary work and health evangelism. Ron and I also have worked at the Lifestyle Center at Wildwood, so we've seen over and over again how God's work through the health evangelism and how people have that new lease on life. We're there we go, going too fast here. We're fully supported, obviously, by the conference. You see Ed Wright there, as well as Mark Finley, Pastor Charles Cleveland, Steve Grabner from OCI. They are there. This was our dedication of our world headquarters. Our global headquarters happens to be right down the street in Wildwood, Georgia. We have trained over 26,000, I got to coordinate here. Okay, 26,000 church members and pastors and lay people, conference workers, as well as we've been in 95 countries. So what do we do? Well, how do we help churches? Well, we customize church trainings focusing on health evangelism. We have also a 1-month online school, and I find that this is usually what most people in this country find to be the most convenient for them. But we do go out to churches and we'll do health emphasis weekends. We'll do a 5-day program, a 10-day program, whatever the needs of the church are. We want to incorporate health evangelism into their cycle of evangelism. We also, around the world, have 1- and 6-month training schools. And we also, as a ministry, provide counsel to people who are trying to put forth health evangelism as their first agenda order in order to reach people, for the three angels message. The nice thing about our program is it is a balance between the spirit of prophecy, biblical principles, as well as practical and scientific study. So we make sure that our program combines everything so that we can reach people with all of that. This happens to be our curriculum. It's called the Essentials of Health Evangelism. It's a 380-page curriculum that is normally done in about a 1-month school. Here in the United States, like I had said, most people opt to do this through an online program. So when we go out to churches, when we meet people, they have that desire to continue to learn more about health evangelism. We have this option here. As well as we are trying to be doing schools, we're going to try to put this into a 2-week program for people to come and do this actually in person. We have a lot of resource material. We have DVDs that are great for church training as well as for personal. So we do have those in English and Spanish. By the way, our training manual is in about 17 languages now. We continue to translate Portuguese, Spanish, English, obviously, French, Mandarin, Russian, and the list goes on. I can't even think of all of them. Again, this is just a little bit about our online school. It's the Learn on the Go. The online school is actually 125 hours as the regular full intensive classes, but you have a year to complete it. Usually when we do it on premise, it would be a 1-month or a 2-week ultra intensive. The health message breaks down the prejudice, the walls of prejudice. Ellen White in Testimonies, Volume 9. Excuse me, I'm getting over a little something, so bear with me a little bit. As a means of overcoming prejudice and gaining access to minds, medical missionary work must be done, not in 1 or 2 places only, but in many places where the truth has not yet been proclaimed. We are to work as gospel medical missionaries to heal the sin-sick souls by giving them the message of salvation. This work will break down prejudice as nothing else can. Health reform a lot of times can be used in the wrong way. And we understand that it can be a turnoff to many people. What we want to do is we want to open this up to give people the freedom of understanding that our health message is not oppressive, but it's actually freedom. And how we can actually use that to touch people for the kingdom. We know that Christ is our pattern, right? And we have to think about him as standing in front of us as the pattern man. We want to minister to people as Christ did, don't we? We think of Christ's method alone, and that's what we use when we train in health evangelism. This is on your sheet, but these are some of the classes that we can facilitate. We do health classes as well as the spiritual. And what we try to do is meet with the health ministries people or the pastors like yourselves. And what we do is we try to focus on what is the needs of the church. We try to look at 3 different ways. An introduction to health evangelism, getting started, kind of like getting to know, where your church, what they can use to reach their community. We also have one, disease and treatment, healing the church. A lot of times, some of our churches are not even, are ridden with maybe diabetes, heart disease. Even though we have a health message, it does not mean that we all adhere to it. Isn't that correct? So sometimes we have to go in and we do more focusing on disease and treatment, getting the church healthy. And then, of course, outreach and evangelism. Then there's some churches that are just ready to go. And what we can do then is we can really help facilitate programs like training for health expos or training churches to do cooking classes. Sometimes you think it's you may have like, oh, so-and-so is good at this, but do they have all the knowledge and all the resources they need? So we can come in and we can help with things of that nature. And then here are some of our spiritual classes that we do. So you see here we have evangelism and soul winning, finishing the work, knowing God's will in your life. These are things, and we can make a combination of any of these subjects we can put together and put it personalized for your church. And you see here, this is just a picture. We do health expos, so we'll come out and do a health expo with your church. We'll do the training ahead of time, get everybody in where they fit, and then go ahead and go forth with a successful evangelistic event. And some cooking classes, not only cooking classes for the church, this was done at a local hospital, a non-Adventist hospital. We had about 35 people at this 35 people at this center. So what we did was we ran a series of health topics, heart disease and diabetes, and then we ran the cooking classes in that week time period. So when we're planning with the churches, we plan to whatever venue they have, whatever they're looking to do, we make sure that we can work with them. Of course, here's a graduation of some of our students when we've gone. Like I said, we do trainings all over the world. This was one of our graduating classes in Ecuador. I want to just also tell you that we also have some materials that we can provide. We have something that just came out called Light Up Your Life. And what it is it's actually like a health coaching tool. When you meet people, whether it's just say at a health expo, somebody who's gone through the program, or just even at a dinner with the doctor, where you're talking to someone, and they've said that, listen, I really want to get in better shape, or I'm trying to, I have diabetes and I'm trying to overcome some of that medication. We have a nice tool that kind of personalizes to almost like a health coaching level. It's where you go out and you can reach the person and say, you know what? Why don't we meet next week? I'll meet at your house and we'll go over some of these. And it gives them an activity to do, and you get to work with them. And you kind of meet on a weekly basis. It's a wonderful outreach tool that, like I said, just a few months ago, we launched it, and it's been very successful in reaching people. So we've been really excited about that. I'm just going to have them show a short 3-minute video on light, and then I know that we're not taking any questions, are we? You said at this time? No questions, right? Okay, so we're going to show that video, and then if you have any, yes? No, not show the video?
No, I'm sorry. What was your question?
To show a 3-minute video.
No, I'm sorry.
Okay, we're going to try to show the video then.
What is health evangelism? Health evangelism is using health ministry as the right hand of the gospel. It is reaching the heart of souls using Christ's method, who first found ways to mingle with men and minister to their practical needs. In this way, he won their friendship and opened the door of their heart, before calling them to surrender their lives and follow him into a life of service. Light, or the Lay Institute for Global Health Training, has worked as a supporting ministry of the Seventh-day Adventist Church since 2008, conducting health evangelism training in over 200 conferences across 90 countries. As a result, over 25,000 church members have been trained and equipped in how to let their light shine to communities around the world. Light's primary training option is a 125-hour intensive course called the Essentials of Health Evangelism, normally conducted on-site at locations around the world in a 3 to 4 week intensive, but can also be taken online, so you can study at your own pace in the comfort of your own home. Light's comprehensive training manual is available in multiple languages and is the basis for the students' theoretical and practical hands-on training. While taking a Light course, students learn the principles of health and healing, nutrition and vegetarian cooking, natural remedies like hydrotherapy, massage, herbs, and more. They also learn proven effective outreach methods, like how to use health as an entering wedge while ministering door to door, how to mingle with the community and discover their needs through vibrant health expos, and how each church can establish their own community-based health club. To get involved, invite Light to conduct a health evangelism training in your district and watch your church come alive with activity and truly be a light in your community. Over 60 certified Light teachers are working year-round to provide this training worldwide. You can also visit our website to connect with one of our 40 Light affiliate schools that provide more advanced health evangelism training anywhere from 6 months to 1 year in length. Jesus is coming soon, and the world is in great need. Now is the time for God's people to reveal the character of God through loving ministry. Now is the time to let your light shine.
So again, I just wanted to let you know that we do travel all over the country. We are available for your church. We can, like I said, we can come for a weekend. We can do a Friday, Sabbath, Sunday. We can do 5 days. We can do 10-day programs. We can do anything that fits the needs of your church. And again, if you see all those topics, we can customize a training for you and the needs of your church. So I thank you for your time. And if you like, we have some business cards with us. And reach out to us, and we'd love to hear from you. And we'd love to schedule something for your church. Thank you.
Okay, thank you, Karen. Next is Marlene Garen. Marlene has been in charge of our health testing for a number of years after following with Betty Garver, who had started at Southern with testing for our teachers and pastors. And so we're glad that Marlene is here. It's Be Well. We all want to be well, and she'll tell you how to do it for your church and community.
Thank you, EW. Great. Thank you guys for having me here. Marlene Garen, and Be Well Forever is the name of my company. So what we do, you can start our slide number 1. We do come on site to, we can come to your churches, but we also have been known and have been doing in the past to your camp meetings as well. So we started as a group of nurses that really got tired of working in the health profession and realized we were just passing out pills and passing out things that were really not doing any good to our patients. So I have collected a group of nurses that are very much like-minded as us, and we travel in the community to do those type things and spread the message. Just like Karen was said, breaking down walls, that's what we're trying to do in the community. Next, I guess we could do. I don't have a clicker with me, so thank you for doing that. We can come on. Oh, clicker. EW. Okay. Oh, here it is. Thank you. We'll get this figured out, won't we? And do it up here, right? Okay, good. All right. So here's our like-minded nurses that are like us. So I love Dr. Garver. I use him a lot, but I love what he said here. Why do you implement a program? It's always just because we care is why. That's the biggest reason, is to always care. And we love that in the church facility as well. Well, let's see. Okay, there we go. It also shows that people, don't really know how much they don't really care how much you know until they know that you do care. I think that's very important. We always provide people with unconditional love, and we try to be very non-judgmental in our care for people, and that's a real good quality to have. And we also know that God holds us accountable for all of our health choices, too, that we provide and do. Our health assessment looks a little bit like this. We can do a lot of things, just like Karen was saying too. I have a health packet in there. EW was able to put that in for Be Well Forever. So it can be different ways. I wanted to tell you this. We have done mass assessments for groups and do things as simple as your height and weight, blood pressure. We also do face screenings, flexibility. We do lots of other testing. But we can also, what we're known for is just to do some simple blood work testing. And that's what we've done a lot with the camp meetings. So with your blood work that you get a lot of things. We have been able to come in and work with the Wickham's group to do reversing diabetes program, which is very good to do that. We also do, of course, the A1Cs. A lipid profile we can do, lots of blood work that's very reasonably priced, and I'll show you a little bit about that. Here, I just wanted to show you, I know you guys are realizing, because we're really focused this year and have been on the rising cost of diabetes. It's really becoming a very prevalent. And the good news about that, you're spreading the message in your church, but we're also spreading that message in the government. We're realizing how much it's costing us in healthcare dollars to prevent diabetes. So part of your programs that you're doing about reversing diabetes is really helping. And I always love it when the government kind of gets behind and puts some money into a program. And I love that they're looking at health ministries in churches and in communities and finding out that they're a lot more effective than some of the programs that they're having. So I love it when we get the national attention too. The A1c test was actually made to measure the prediabetes. We kind of know that the sugar applies to your hemoglobin, and measuring the test of a simple hemoglobin A1c is a great way to tell if you are diabetic or prediabetic. So there's some things you can do, and they all know, even medical community is surrounding us now, saying that our lifestyle preventions are working better than medication for preventing people to turn into diabetes. Prediabetes, if you do nothing about it, you have 2 to 3 years before you become diabetic. So we spread that message in the wellness community for our corporate, and they're real excited about teaching people how to be preventing. Because we know that prevention and early detection is everything. In our medical model that we use, we work at prevention, we look at early detection, and then we have people who already have diseases, so we work at stabilization of those diseases. We provide you with the follow-up results. You get lab testing, you get any type of material that you might need in order to make your decisions for your health, for you and your physicians. These are some of the services that we offer. I talked about our camp meetings that we are doing, local and regional. I've got some calls all the way from Kentucky this year where people are very interested. We have a really good turnout over at the southern campus. Well, we've had to do it at the churches over there for the regional camp meeting here. It's been very effective for us for the last 4 or 5 years. And we all, it's very simple to do. We just advertise it, or you guys have advertised it in a publication saying that we're coming, we're going to be here. It's a simple way to do. I put this in because I thought you would find it very interesting. I was able to speak at a convention in California, at the University of California, from Southern Adventists that we'd taken some materials to. And even in the higher learning facilities, I had to promote. And there was a study that said religiousness and spirituality and health behaviors, does faith promote a healthier lifestyle? And interesting enough, it does. So we can show that. You guys know that. And it's simple. You are promoting the message of health. You know it's the right arm. But it's interesting to know that in our world today, we're seeing that as an answer as well. So congratulations to you as health leaders. When we offer some health testing at camp meeting, we also offer some bulk health testing prices, some free services if you partner with us to do some of our services. If you spend so much money, we give you some of our services free, and I always think that's a really nice option to have. I wanted to leave with just a simple quote. This is by Albert Einstein. Nothing will benefit human health and increase chances for survival of life on Earth as much as the evolution to a vegetarian diet. Did you realize he wrote that in 1930? It's amazing, isn't it? And look at this quote. A physician wellness person needs to learn more about the person who has a disease than about the disease the person has. And that actually was from Hippocrates many, many, many years ago, isn't it? So sometimes we think we're spreading the health message and it's a new and a wonderful, new idea. But it's not a new idea, is it? But it's great you're here to spread it. So my information is in the packet. You guys can call us. We really do try to work with your churches for any kind of program. EW and I are really excited about Dr. Youngberg coming in July. He's going to talk to you about that later, about reversing dementia, just like he's worked with us as reversing diabetes, and I'm excited. So if you have any questions as health leaders, want us to come and provide some testing, we'd be happy to give you a quote.
Did you mention the times and so forth there at camp meeting?
Yes, it usually is from 7 o'clock, Thursday and Friday morning, 7 o'clock to about 9. We try to do it fasting because some of the tests that we require for the lipids and glucose, of course, you would like those to be fasting, so we do it before breakfast.
How many of you have done that testing before over there?
I recognize some faces here.
Well,
I do.
hand raising
Yeah,
up high. Yeah,
yeah,
good.
yeah. And you know why we do that is because we offer them a really reasonable price. Those labs are good at your doctor's offices for up to 6 months. So you can take those right in. You don't have to wait and have labs redone. Saves you an extra doctor's appointment. And we all know the high price right now of deductibles.
Yeah.
So, yeah, it's there.
Thank you for
all right.
coming,
Well, thank you.
Marlene, very
Yeah,
much.
we appreciate it.
Okay, we're continuing to move along. As the next couple get ready to come up, I did not mention that restrooms, if you need, ladies is out on the right in the lobby. The guys go around and down the hall. We will be taking a break. We may have to change the schedule a little bit. I'm trying to decide what to do here, but we will because we're waiting for another person. At this time, I'm glad to have Gabriel and Varnell McClover. And they're going to talk to you for a few minutes about something that's very interesting, and that's diet. They have a cafe in Somerville, Georgia. Somerville, I'm interested in because that's where the Dempseys came from, was the little town of Somerville. And it was famous for a famous baseball player. One of the streets is named there after him. Happened to have been my cousin also. But they've got something else exciting to share with you about what's happening, and so it's also on the left-hand side of the folder. There's 2 sheets, and they'll be talking about that.
Good afternoon, everyone. My name is Gabriel. This is my wife, Varnell, and we own and operate the Vineyard Vegetarian Cafe and Juice Bar in Somerville, Georgia. We say it's a ministry/business. We do a lot more ministry work than actually actual business, but we've been open for 3 years. And we do a number of different ministries through the restaurant. Number one, we do cooking classes. Cooking classes we do once a month. And we've done in-home cooking classes with people. We've done cooking class. We just did a program yesterday at a public school where we did a cooking demonstration and we did a program for the kids. So we do a lot of ministry. And one of the things we want to share with you is some of our experiences that can maybe be beneficial to your church. One of the things we do is what we call a 10-day health challenge. We call it Let the Healing Begin 10-day health challenge. I believe you guys have a flyer in there. We've worked with almost 200 and... Yes. I got talking to the microphone. So we do a 10-day health challenge. We've worked with close to, 260, 270 people over the last 2.5 years, putting them through a plant-based program. What we do, we take their biometers, really not not the whole lipid profile as the lady was before us, but we do blood pressure, we get their BMI, we get their weight, we may do a glucose, and to get their starting point, and then we put them through a 10-day challenge. And we do 4 training modules there. We have a kickoff meeting. We have a couple of plant-based doctors that we partner with, and they come and they do lectures. We do a cooking class, hands-on cooking class, and then we also do a nutrition program. So we take people to the grocery store and we teach them how to shop. We go up and down the aisles, and it's been a remarkable program. And then after we have a graduation, so we make a big deal about it. We make it real fun, and we give them resources to want to continue. And what we've seen over the last 2.5 years has been absolutely remarkable. I think in Somerville we probably. It's a small town with 4,000 population. I think we've probably worked with almost every family. Every family is literally connected. So we've worked with a lot of different people, and the Lord has really been blessing and opening several doors. Like I said, we just finished a program at a public school just yesterday. So what we want to do is share this. We've worked with several different churches. We worked with we did a 10-day challenge within Daresville Church. We did a 10-day challenge at Calhoun Church, as well as we're doing one in Battlefield in March. And we work with Rock Springs Church and, of course, the Somerville Church. We've done these 10-day challenges. And so how does the church members get involved with it? Part of the program is we provide food for them. We make it easy for them to transition to a plant-based lifestyle because we provide lunch and dinner, and we make recommendations for breakfast. So we deliver lunch and dinner to their jobs, to their houses, every single day. So if a church member, like a church, for example, Rock Springs Church, they did it, and they had about 7 or 8 people go through the program, and everybody had their own different. So we did delivery with that. So we actually deliver all the way up here to Chattanooga. Even though we're in Somerville, we deliver right off of close to the Volkswagen plant around here. So yeah, we actually deliver over there. We got many people, and the Lord has opened doors that we've been working with like business owners. So I'm going in, I'll tell you the story. This is a pretty cool testimony. So we had one guy, we have a plant-based doctor, and her name is Dr. Julia Danforth. I don't know anybody who's heard of Dr. Julia Danforth. She's practicing at Gordon Hospital in Adairsville. She's a lifestyle specialist physician. So we went there, we catered a lunch there, and she wanted me to introduce her to one of her patients. So I was talking to him, and he was like, man, this plant-based stuff, I tried it, and this stuff tastes horrible. I'll never eat this stuff again. I know, okay. I need a lapel mic or something. So he came, and I spoke with him, and he was like, I know I need to make a change. This guy had like 10 stents in his heart, quadruple bypass. He was in bad shape, and he knew he needed to make some changes, but he wanted the food to taste good. And I didn't know at the time the guy was having to be pretty wealthy. And he's like, I'm not gonna eat unless it's good. And he was like, well, try this lasagna that my wife made. And it was a plant-based lasagna, a vegetable lasagna. And he was like, wait a minute, this is good. He said, if it tastes like this, I'm in. So we started working with him. And he said, well, at that time, we just was doing classes. And he says, could you come deliver this for me in Dalton? And I said, sure. So we worked out something, and I started delivering food to him. And he just started losing weight. He started doing better. And then one day, I pull up, and I drop the food off, and I'm leaving. He says, no, you need to come follow me. And I said, what do you mean? So he jumps in his car. So I'm following him. I'm like, okay, Lord. Now, this guy used to be in a mob and all this other different stuff, so I didn't know where he was going to take me. So he takes me up to this big company, and he jumps out the car. And he says, follow me. I said, okay. So here I am. He just walks in the building, big building, bigger than this place, and all these people walking around. He doesn't say anything to anybody. Just walks straight in the building. I'm just right on his heels. I'm like, I'm with him. He takes me all the way up some stairs, up to the owner's thing, sits me down and says, tell him what we're doing. That's all he said, tell him what we're doing. I said, we're doing God's plan. He looked at me like, what is that? And I said, the body's designed to heal itself, and it will heal itself if you give it the right conditions. So during our 10-day program, what we try to do is create conditions with just giving you healthy food. And we know God's plan is going to work because the Bible says so. And he's like, whatever. So the guy gets up and says, you need to sign up for the program. And he gets up and leaves. Now, this guy was big. And he just left. So he just left me there with this guy. I was in corporate sales for 10 years, and I used to do this. So I was very comfortable in that situation. And him and his wife ended up signing up for the program. And that's how we end up starting the delivery program. And this was like, last year. So that's how we've worked with so many people. But the power of the program is we let them know that this is God's plan. So I tell them, when this is over, this is God's plan. So when you see your diabetes, your blood pressure go down, you see your blood sugars go down, you see your cholesterol going down, and you start losing weight, so don't come back to the Vineyard Vegetarian Cafe and say, hey, we thank you so much. I said, no, this is God's plan. You give God the glory for it. And it's been an incredible experience, opened many doors for us, and so we want to share this with you, share this with churches. We see it as a way to literally bring down the walls. You talking about Christ's method alone, bring true success to reaching the people. He mingle with men as one is already good. He shows sympathy. Minister unto the needs, win their confidence, and bid them to follow me. So in 10 days, doing this program, you can get all the way to the point where you win in somebody's confidence. because God's plan is going to work. And if you show it from the Bible, they're ready to go. So in terms of after the program, you're talking about, so we give them a survey. And we ask about how the food, et cetera. And then we have some upcoming events. Would you be interested in learning more about health through the Bible? You know how many people click yes? I mean, my presentation, like, you know, I was in sales, so I'm you know, I know how to present. So I'm doing my slide, the third slide, every time I do it, never fails. Third slide, fourth slide, somebody asks a Bible question. So I never knew the Bible said that. Or, wow, that's interesting. And they want to get you to answer the question right then and there, but I said, that is a great question. What are we going to do? We got to set up an additional time, and we're going to look at that at a different time. And so you already have a Bible study set up. So we see the power of that, the program. So what we're going to be doing, EW had approached us about sharing a little bit about our plant-based cooking school. So we're going to be doing a seminar. It's going to be from 10 to 2. And now I don't know how many cooking classes we did over the last couple of years. I don't know. We tried to do a number. My wife says about 40. Elizabeth says way more than that. So we're going to share some of the experiences that we've had. What works, what doesn't work, how do you market it, how do you get people to attend each and every month. Now we're unique because we are a restaurant and we come across people every you know, they come in, they come out, but there's still some things that we can learn that can cause people to come to our cooking class and come on a more consistent basis. So this is going to be a hands-on thing. So my wife, who's the head chef at the restaurant, is going to be going and doing. You want to tell me what you're going to be doing?
So what we will be doing at the cooking school, we'll go through different demonstrations on ways to get the community engaged to keep coming back to the cooking classes, teach you different recipes, and then we'll share a meal together on the recipes that are tasty and help people to transition to a plant-based or vegetarian diet.
Yeah, one thing we hear, which is pretty cool, and this is something we're actually doing something in the Cartersville church that's we're next week. So one thing we hear is going through the 10-day challenge, people have a great experience, and what they say, my kids will never eat this stuff. They'll never eat it. I said, oh really? They'll never eat it. I said, we got something for you. I said, how about a kids cooking school? So we said, okay. So this is an idea we were just playing around with, because that's what we heard a lot. So we were talking to Pastor Frank down in the Adairsville church. Well, he was in Adairsville, now he's at Cartersville, about doing something like this. So we're putting together this weekend and we're going to do what we call next weekend. We're doing a kids cooking school. It's going to be a 3-day cooking school. So the first night we're going to come in. It's going to be Sabbath after sunset. These kids from the community, they're going to come in, and we're going to give them like the 8 laws of health. Daniel, make it real fun, like we did at the school yesterday, this public school yesterday. We had a great time going through the 8 laws of health, making it fun for the kids. Second day, we're going to, and we're going to break them up into groups. And then the next day, they're going to come in, they're going to go do hands-on with their designated volunteer leader from the church. And then on the third day, it's going to be a banquet. So the kids are going to it's going to be a banquet, and the kids are going to invite their parents to come to the banquet. So you're talking, if we have 20 kids, if they say, hey, I want to bring 4 people, guess what? Just like that, you have 80 people. So guess what we're going to do? We're going to take advantage of that. So as they're eating this nice plant-based food, we're going to have one of our plant-based docs lay it thick, as I like to say, and really take that opportunity to go through a health lecture. And more than likely, 9 times out of 10, they would never sit down for a health lecture, but because their daughter or their grandchild invited them to come, now they're hearing more about plant-based nutrition and how they need to transition off. So these are just creative ways to get and bring the walls down, because the health message is not designed to convert somebody. It's just literally to bring the walls down for the gospel can go in. So we want to share some ideas that have worked in our church. For a 10-day challenge, our church sponsors 2 people a month to go through a 10-day challenge, right? So I'll give you an example. Her name is Roxy. She came into the restaurant. Yeah, she's a cattle farmer. right? She's a cattle farmer. That's what she do for a lot of them. They raise cattle. She comes in, and her husband is having health issues. She's having health issues. And normally I say if somebody comes in our restaurant, I say, oh, God sent them here. God had to send them here. And so she's sitting at one of the corner tables, and we happen not to be that busy that day. So I go up to her, and I go sit down with her. And I say, hey, how are you? I said, what brings you here? And she goes, well, and she just looked like she was distressed. And she goes, you know what? I'm just having some health issues. And I said, well, tell me, if you don't mind sharing, let me know. And she said, she's having some different issues. I'm not going to go into it. And she goes, I've tried everything. I looked at her right in the eye. I said, have you tried God's plan? She goes, what is that? And then I started explaining the 10-day challenge. And then she's like, well, I don't have money for this stuff. I can't afford it. I said, tell you what, give me your information, and I'm going to go to my church and see if they'll sponsor. I knew my church would sponsor her. But I wanted her to get to know that I'm going to go back to my church, which happened to be a Seventh-day Adventist church, to go and see if she gets sponsored. So she came and went through the program. I said, great news. Our church heard your story, and they want to sponsor you to go through this program. What do you think? Oh, I'm so excited. So she went through the program, took it. Everything we said, she did it. And she lost like 10 or 12 pounds. She had a great result. She goes, and she came in there just with tearful, and she's like, I want to give a testimony at your church if you allow me. I want to go and thank these people for just caring so much about me, et cetera. And she came, and man, she gave a powerful testimony. Our pastor was very, very receptive, powerful testimony. It wasn't no dry hour in the place. She was talking about how God literally led her here. She said in her testimony, she went to a health fair that from another Adventist church somewhere else, and she believed, and she lost contact, but she goes, I believe the Lord sent me here for the follow-up. And it was a powerful testimony. So we praise the Lord for that. So just with that, the plant-based cooking school, it's going to be April 28th from 10 to 2.
Turn just for a minute on the right-hand side in regards to personal ministries. The first thing that's listed there, I think, after the blue sheet, is probably an advertisement for the prison ministries workshop. In most of our churches, we do not have a prison ministries coordinator. But yet we have folks, over 120 people in this conference going into prisons. We have tremendous number of things happening. I personally have had the privilege of baptizing a few people up here in one of the prisons where they have a large number of people in Bible study programs. But we've got people all over the conference going, and so what we started a few years ago was at least every other year is an appreciation dinner. So I want you to notice this as the personal ministries director or health ministries director. If you don't have a personal ministries director, make sure that if there's anybody in your church going into prison ministries, that they come for this prison ministries dinner. It's going to be at the conference office. And Elder Johnson, who is head of prison ministries for the North American Division, will be there. And I think that they will enjoy, coming. So hopefully you can make sure that it's happening with the folks that are there. The next thing after that is the advertisement for the Share Him, which is the first week in November. That is a training for laymen who want to be involved in evangelism. Now, through the years, it's become a very big program. We've had sometimes 50, 60 laymen that have been trained. It is Ralph Ringer, Southern Union coordinator, will be conducting this. It'll be at the conference office. Like I said, it's the first weekend there, whatever that date is in November. Just a quick example of what can happen. A few years ago, I was at there in Catoosa County for a training for this, and leading in, or it's actually a personal ministries training, but we only had 2 people show up because there was a memorial service at one of the churches there in Catoosa County. If there's a person shows up, we don't cancel it. And there were only 2 people that came, but one of the people that came was a lady who came all the way from McMinnville, Tennessee. She was a new Seventh-day Adventist, and she saw this advertised, and she said, I came all the way down here to see if it was something I'd be interested in. She was interested in it. She went on the internet. She signed up. She called me and said, EW, I'm scheduled to be an assistant speaker in Kenya, Africa. What do I do? I said, well, if the Lord has worked it out for you to go, then that's what you're going to do. They'll train you at our training program. They will give you, you'll have the DVD or the video or the slides with you. Well, then she called me about a week later and said, well, the main speaker can't go. They want me to be the main speaker. What do I do? I said, well, if the Lord opens the door, you walk through it. When she came back, she called me and told me all the stories, and the next spring, I just happened to be there in the church at McMinnville when she was showing her slides. She was so excited. So if you've ever thought about being a speaker, one of the advantages of going in other countries is you have a translator. So you don't have to quite worry about what you're saying because the translator will make it right. So make sure that you folks make this clear in your churches. And we'll advertise this more as we get closer to it. But this is something you can encourage laymen to do. And then they can come back and hold meetings right in your church or in your community. Remember, the Lord has called us as laymen. This is the army. The army's not the pastors. They may be the generals or whatever, but the battlefield, most of the people out there are what? The soldiers are you, the laymen, okay? All right, at the very back on the right-hand side, again, I must emphasize again the Bible Research Program. This is the Bible Correspondence Program through the conference that is by far ahead of anything else. 65% of the people that start with that lesson that you see there finish. 65%. But besides that, we have the video ministry. Now there are 2 websites, and we are at an all-time high where we're getting this last year we had over 1,000 people sign up off of the internet just watching the videos, and that was one website. It wasn't the other website. So when I want you to be aware of that, because one of the easiest ways to witness are the simple cards that we have that you can pass out to the community. One is called BibleResearch.info. The other is BibleStudyTopicsGuide.com. I've got boxes of cards right here you can take with you, give out to, just let people give them to friends and relatives. The Holy Spirit will impress people to look. There are 43 videos covering basic Bible doctrines. The first few years we did this, the number one thing people were watching on the internet was the state of the dead. We never start evangelism series with the state of the dead. I have just finished 7 videos that cover, it's based on Matthew chapter 12, where the rulers asked Christ for a sign of who he was. He said, there's not a sign except as Jonah was in the fish's belly 3 days and 3 nights, the Son of Man will be in the heart of the earth. Most people think that meant the grave. Well, Christ was only in the grave a full night of Friday night and most of Saturday night, but he talked about 3 days and 3 nights in the heart of the earth. And so we started right where Desire of Ages starts, with the Last Supper, where Christ was a servant. If the rulers had been watching, they would have seen that. He was being a servant. They were expecting a king, we're the guys that are supposed to be washing my feet. Jesus said, I'm going to do it. Well, then he goes into Gethsemane. We've entitled that History's Most Important Decision. We all know the attack he was facing under Satan, where he was sweating drops of blood. And he's struggling, clinging to the ground, as Desire of Ages tells us, from the very ground that he had created. And he said, and our sins were separating him and the Father. And he was, my God, where are you? And it came down to the critical moment. The angels are watching in heaven. Read about it, folks. But it's on the video. People can see what we're talking about as we explain this. And then it came to the critical moment when he said, nevertheless, not my will be done, but yours. That was the decision. God was able now to send Gabriel down to help him. And you know the rest of the story. And then we have, of course, the arrest and trial, the nobility on display, the crucifixion, on through the weekend. After most people stopped at the resurrection. But we know that he witnessed on the road to Emmaus to disciples and later in the upper room. And there you have 3 days and 3 nights. If you'd like to pick up a free DVD or a free CD when you leave, just one per family, please. There's some up here because we want you to let church members know this is an easy way to witness. I have one lady in this conference that has passed out now 32 boxes of these cards. And there's 250 cards in a box. Folks, it is an easy way to give. I give them to waiters and waitresses wherever I travel. I just walk up and so take whatever you want when you leave here today, okay? At the very back, on both sides, I've already told you, there's a resource sheet and a resource catalog that can help you in health and personal ministries to what you may need help on. And then we're going to take a break in just a moment, but the last thing I want to talk about is the Grundy Reversing Diabetes Program. Most of you are fully aware of it. You will find it at the back on the left-hand side, right before the resource section. You'll see where it's, there's a sheet also right here. This is the training that's coming up in Savannah in a few weeks. I know it's a long way off, but we've had a lot of training here. Folks, this is at an all-time high. If it has not been done in your church, you should do it. The Chattanooga Church just down the road just did one at Eastgate. It used to be Eastgate. They had over 60 people that came. Catoosa County, we did one in Ringo last year. 32 people came. One guy came, he had taken karate. I had taken karate, so it kind of gave us a chance to talk to him. He was a Baptist, and 5 months later when we did our follow-up, I hardly recognized him. He had lost 44 pounds. His cholesterol had gone from 210 to 137. His wife was off of over half of her medication, had lowered most of her scores. And you know what? When he saw me, he said, "E.W., you have changed my life." He said, "You've changed my life." He said, somebody at his church said, "Butch, what in the world are you doing?" He said, "I've quit eating meat." He says, "I've just quit eating meat." Well, I was going to be at the Ringo Church, and I had a sermon, and so I called him. I said, "Butch, I've got a health rally on Sabbath afternoon." Now, at the health rallies, we concentrate on cardiovascular disease, type 2 diabetes, and now Alzheimer's from a nutritional and an exercise standpoint. So I invited him. But I said, now I am going to be preaching, but I don't want you to feel like you've got to come to the sermon just because you're going to be there, but it will be like a Baptist sermon. Well, I didn't know until I'm shaking hands with people at the end. He came up, there he was. He said, "E.W., that was a good Baptist sermon, and you even made a call at the end." Well, I called him Monday night, and I said, "I appreciated you coming." He said, "Well, you know my dad is a retired Baptist preacher." And he said, "I called him to tell him I was coming." And I think he called to get a few little ideas maybe about the Seventh-day Adventist Church. But he told me again. Folks, I had him come to the executive committee at the conference office to tell his experience. Because I think we may have somebody that's on an all-meat diet or something, and that's not a good idea. So he just keeps telling people, "It has changed my life." Right now, we're doing another reversing diabetes program in Fort Oglethorpe, same county. We've got 43 people there. Gabriel and Vanell are there with the cooking program. Guess what? I bumped into another football player that I coached long ago. And so I'm going to be following up with some spiritual programs. My point is the Grundy program works, folks. If you've not had anybody trained, I hope they can go to Savannah. The Southern Union had one scheduled 1st of March. That's been changed. I'm not sure when it'll be. If you didn't pick it up when you came in, there are some free little books back there. Just you can take 2 or 3. I don't think I have any up here, but they're on the table. It's the newest he's got explaining the diabetes program. Okay? We're going to take a break right now for 10 minutes. And at 4:30, we're going to start the Alzheimer's video with Dr. Wes Youngberg. And following that, we will be talking about another very important program that we're starting dealing with drug addictions in our conference. So both of these things are really important. Youngberg's situation is huge as we talk about getting away from Alzheimer's and preventing Alzheimer's and even reversing it. So if you have to leave, I hope you don't leave till after these 2 programs. I will also then be talking about how things I've got to give away. Folks, on this table, there are some really big things up here to give away, some full set of some of these things. We will be drawing to win these. Come up at break and look, but don't take anything, please. Just look, just don't take, okay? Health things are here, personal ministries on this side. Let's get up and take a break right now and move around for about 10 minutes, okay? Here we go. The mental health program is pretty new, even in the North American division. They've talked about it a long time, but we've not really had anything getting off the ground. So we're very fortunate that we have an instructor, Tawan Usry, who has spent over 20 years teaching in this field. And so Tawan is going to talk to you about it. We have a team that we've already put together in the Chattanooga area. He will talk to you about how this can get started in your church and how he can help you. You need to use this mic. And hold it up right in front.
Can everybody hear me? All right. So just real quickly, just want to just talk very briefly about the mental health ministries that we've been conducting for the past year and a half. Primarily what we've been aiming to do is when we're invited, we will go into churches and either do a mental health sermon or a mental health seminar, typically in the afternoon. And pretty much what we talk about is raising awareness for mental health issues that are going on. If you look in your folders on the left-hand side of your folder, this is a flyer that we put in here that kind of outlines what we do in regards to mental health. We talk about biblical principles, anxiety and depression, resources and referrals, mental health signs and symptoms. And so the question that we always get from time to time is, why is this such an important topic, and what is the church's role in regards to mental health? Well, if you are not aware, unfortunately, we are living in a day and age where at least 1 in every 4 people have been diagnosed with some type of mental health problem. So you can look around the room, and we have quite a few people in the room, and so it'd be understandable if there's been some mental health difficulties for people that are in this room right now. Also, too, we are looking at an epidemic in the year 2020. According to the World Health Organization of the United Nations, they are saying that depression is going to be the leading cause of disability in the world, okay? Another thing that's going on, we have about 18% of the American population, unfortunately, suffers from anxiety. We have about 7% of the American population, unfortunately, suffers from depression. So coupled with those stats and the things that are going on, we understand why this is a major issue. There are primarily 4 to 5 causes of mental illness that can take place. And the first one, of course, is environmental issues. The second would be chemical imbalance of the brain. The third would be genetic issues. The fourth, of course, would be stress. And then the fifth one could be relationship problems. So has anybody here ever had any stress in their life? Okay. You having stress in your life, of course, you're going to have some symptoms of anxiety, potentially some symptoms of depression, or just some symptoms in general that can cause a lot of difficulty in your life. And so none of us are immune to having mental health problems. And so because of that, we want to talk to the churches about raising awareness in regards to mental health. Did you also know that 40% of the people, members of the churches, who have mental health problems usually go to a pastor or a priest or a minister before they go to a mental health professional? 40% of the people. And so again, that's another reason why we go into churches and we talk about these issues of mental health and mental awareness. Another thing that we wanted to just really briefly make you aware of is this flyer here. This flyer, also on the left-hand side of your folder, is a program that we're developing right now with stress, anxiety, and depression. We are going to be doing some of the similar things, raising awareness. It's more of an educational program, but we will also be conducting that. That program is going to be a 6 to 8 week program that we're going to be doing in the churches, educating people on those issues in regards to how to deal with strong emotions like anger, loneliness, fear, grief, how to deal with stress, how to deal with anxiety, and how to deal with depression. Okay? At this time, I just want to know if anybody have any questions. Any questions about mental health, mental illness, or anxiety and depression? Usually I have a lot of questions, so I'm a little bit, yes.
What about do we need a professional in our church to be able to conduct this?
If you are just doing educational programs, that's what we're asking churches to do right now. I am available to come in and do a sermon or a seminar in regards to mental health, just to raise an awareness. If you are having someone in your church who is a mental health professional, that is the best option. We want to make sure that people who are talking about mental illness have some type of credential, either a degree or a certification or some type of license in regards to that. Very good question.
Well, I'm going to start off by telling you what we've got going up in Grundy County is absolutely amazing. God is breaking down barriers. He's destroying a lot of just the false ideas that people in the community have had about Adventism and the walls between other churches and things like that. It's been absolutely phenomenal. But first of all, I just want to talk about addiction in our country today just a little bit. Did you know it's the leading cause of death for people under 50 years of age? Overdose. It's above car accidents, above anything else. It has really taken off. In fact, in 2017, 70,000 overdose deaths occurred in the United States. That is higher than even car accidents. Back in 1972 was the highest number of deaths they had due to car accidents. This far exceeds car accidents, even at its worst time in our history. Any idea how much addiction and overdose costs the economy? Just to give you an idea. Total healthcare cost in the United States, $3.5 trillion. Cost of obesity, $147 billion of that $3.5 trillion. Cost for addiction, this includes alcohol, tobacco, and drugs, by the way, $820 billion. Just gives you an idea of the scale of what's going on. Addiction rates have been growing, especially in rural areas. Where we're at, we are definitely in a very rural area. In fact, it's the poorest county in the state, Grundy County is. But I want to talk to you a little bit about the history of what's going on up there. I watched a documentary a little while back called An Appalachian Dawn. Now, I would encourage you, write that down. An Appalachian Dawn. And if any of you can get a hold of that documentary and watch it, you'll see what happened in a small Kentucky community in Manchester, Kentucky. We actually have an Adventist hospital there. And how that community took their community back from the drug problem that was plaguing them back in the early 2000s. And they pulled together, all of the churches in the community pulled together. I'd like to read some Ellen White quotes for you, but they pulled together for the purpose of taking back their community from addiction. Now, today we call, addiction, recovery from addiction, we call it the recovery movement. Back in Ellen White's day, it had another name. Does anyone know what name that was? What's that? The Temperance movement. That's exactly right. Let's see here. I'm going to pull a couple of quotes out for you. The Women's Christian Temperance Union is an organization with whose efforts for the spread of temperance principles we can heartily unite. The light has been given me that we are not to stand aloof from them. But while there is to be no sacrifice of principle on our part, so far as possible we are to unite with them in laboring for temperance reforms. Ellen White herself spoke for the Women's Christian Temperance Union. By the way, it wasn't just about alcohol. They dealt with temperance in any number of different ways. Now, just to give you an idea, do you know what else the Women's Christian Temperance Union promoted? This may shock you. They promoted national Sunday legislation. She did not let that keep her from working with them. What does that tell you? So, by the way, the second president of the Women's Christian Temperance Union became a Seventh-day Adventist while she was in that position. So apparently Ellen White had some some influence there, and actually she was a close friend of Ellen White. They wrote back and forth to each other after that time. Counsels on Health, page 436. My husband and I, in our labors, united with these temperance workers, and we had the joy of seeing several unite with us in the observance of the true Sabbath, including that one woman who was their president. It says, among them, there's strong prejudice against us. But we shall not remove this prejudice by standing aloof. God is testing us. We are to work with them when we can. And we can assuredly do this on the question of utterly closing the saloon. So, what Ellen White is saying is that by doing this, we will help destroy the prejudice that's against us. We have seen that very thing happening in our community. Up where we're at, the culture up there, it's very, just a very traditional, very Appalachia community. And people go to churches that they've attended for years. Their families have attended those same churches for years, maybe even hundreds of years. Oftentimes, it's a family member that's the pastor of that local church. Those churches did not associate together, hardly at all, before this addiction epidemic really took hold. But it's gotten so bad now that people realize that, you know what? All those things, those little petty differences, between, we worship like this, you worship like that, it's meaningless when you have people out there, when you've got friends and family members who are dying. And that's exactly what's happened. Well, we ended up bringing down Pastor Ken Bolin, who kind of led out in that movement in Kentucky, that Appalachian Dawn documentary that I told you about. We brought him down, and he did a presentation. There were over 200 people in attendance, which is really amazing for up where we're at. The whole county is only a population of about 13,000 people. So at 200 people, we had close to 20 pastors in attendance, local pastors. And as Ken Bolin began to present, he says, you know what? We prayed for 6 years before we did anything. If you guys want this to work, you're going to have to start with prayer. At that point, our county sheriff, who's also a pastor, he was pastor of that local church, he stood up and he said, okay, guys, who's first? So we began having prayer meetings at local area churches every Saturday morning at 8:30 in the morning, up to 130 people showing up, 8:30 Sabbath morning. These are non-Adventists mostly. Now I'll tell you, I think our church is very well represented. We typically have usually around 10 people at these prayer sessions. But here, for Seventh-day Adventists, we already get up early on Sabbath morning, right? You got to get up, you got to go to church, right? What about everybody else? What are they doing Saturday mornings normally? Sleeping in? Watching the Saturday morning cartoons with their kids, right? Stuff like that, mowing their lawn. These people are coming out on Saturday mornings to pray for recovery in their community, to pray for the poverty that has affected this community, and we are seeing things happen. We are seeing things happen. It's been truly amazing. But anyhow, in the process of this, we have formed an organization called Grace. How many of you I got here a little later than some of you. How many of you got one of these pamphlets right here? If you do not have one of these pamphlets, I would strongly encourage you. They've got them back there. They've still got a few more. Get this pamphlet. We also have our first newsletter, Grace News, right here. You'll learn a lot just by looking at this newsletter in terms of how Grace operates, how it runs. We have several teams have been formed. We've got the peer recovery team. My wife actually kind of helps to lead out in that team. She's right back here. I'm going to have her talk to you in just a couple minutes here. And their mission is to, within Grace, to establish 12-step recovery programs, different types, different ones for different people. You've got Alcoholics Anonymous, Narcotics Anonymous. You've got support groups, Al-Anon for families. You've got Celebrate Recovery. How many of you are familiar with Celebrate Recovery? That's a faith-based 12-step program. Very good one, by the way. How many of you are familiar that the Seventh-day Adventist Church has a 12-step recovery program? Any of you familiar with that? Yeah, so there's one there. They're all different kinds, and you know what? Different ones are going to connect with different people. And so we want to have something for everybody. We are hoping, actually we are opening, we have already opened a community recovery center that's being housed in what used to be the school building right next to the church. The school closed down about 4 years ago, and the church was wondering, what can we do with this building? We're paying for all these utilities. What are we going to do with this building? And so, I've already been talking with someone else in the community who was trying to get this thing going, and we said, well, what do you think of this? And they decided to move forward with that. So we have the peer recovery team. Then we've got the pastoral team. Pastoral team made up of pastors from various area churches, people involved in ministry in the various area churches. Talks about our Saturday prayer services. We've got a number of churches that are donating, that are helping to provide financially for the organization as well. But the purpose of the organization is to try to find all of the different needs that someone in recovery may have. A lot of times these people, they might get out of jail. They need to get into a program to get cleaned up. Some of them, maybe they've already been in a 30-day program and they need something a little longer. That wasn't enough for them. Some of them have insurance. Some of them don't have insurance. That kind of thing. So getting them into a treatment facility. They come back to the county. They didn't, and prior to what we're working with right now, there was nothing. No support system whatsoever. They'd come back up to Grundy County, and next thing you know, they're back in with the same friends. They can't find a place to hang out to stay away from. Next thing you know, they're falling back into addiction once again. So we hope to have a place where people can just come and hang out. Maybe just a few couches in there. Maybe a place where they can get some help putting together a resume, finding out which area employers are willing to employ second chance. That's tough. You get out and you've lost your job. You probably lost your family as well, and you got to get back on your feet. Some of these people, they don't have their driver's license. Some of them, they can't even find their Social Security card or their birth certificate, and they need help just navigating all of those things. Things that sometimes for some of us are pretty easy, become very, very difficult when you've been arrested for possession or something like that. It creates a lot of challenges through that process. So the state of Tennessee has just about given up on state-run addiction treatment programs. Did you know that? They're still funding them to some degree, but what they found is that secular-run programs are not nearly as effective as faith-based programs. So as a result, grants are being made from the state to faith-based recovery programs to get people in, to get them cleaned up, get them to hopefully provide a good platform for that. And there's all kinds of programs that churches can get involved with that are promoted by the local governments, things like that. Transformation Project is one that's really close by here in Chattanooga. And if people get involved in that program, it's a Bible study. Very good. In fact, there's a member of one of our churches here locally that was involved in putting that material together, by the way. But it is, if they enroll in that program, they can get time knocked off of their sentence as a result. And you know what? If a church opened up that program, they'd have people coming in twice a week into your church to go through those programs. This is a great way to get people into your church. Another thing that's very important is realizing this is not something we do on our own. I didn't read you all the quotes I have from Ellen White, but she is very clear. This is something where we partner with other churches. There are things that we view differently than other churches. But when it comes to the power of Jesus Christ to set the captive free, that is something that we can wholly agree with them and unite with them on, and especially in this area of addiction and recovery. So as a result, there's faith-based coalitions forming in each community. You have to have a coalition in order to obtain government grants and that kind of thing. There's coalitions all over the place. Churches can get involved in local coalitions, or if you don't have one, you know what? Get started. Talk to your pastor. See about if you can get one started in your county or in your community. And that's something I'd strongly encourage. And that's what we did up there in Grundy County, is we kind of let out in that, reaching out and helping to form Grace, which is a faith-based coalition. Another thing, Tennessee has a training program for people who have been in addiction. How many of you know of someone in your congregation who has struggled with addiction at some point in time? Is there anyone in here who struggled with addiction at some point? Okay. All right. So if you've been clean for 2 years, you can enroll in this program. It's called a Certified Peer Recovery Specialist. And I'd like to actually have my wife come up here. My wife is a Certified Peer Recovery Specialist, and have her share a little bit about what a Certified Peer Recovery Specialist does.
Hi, my name's Kelly. I've been working on my human service degree, and when we moved up to Grundy County, I asked the previous pastor, who should I work with for my precept? And so he told me to introduce me to Dave Hodges, who is over the addiction over 10 counties here within Tennessee. And when I met him, I ended up starting to work in the courthouse, the local courthouse, and I was helping to facilitate in getting grants and stuff to be able to help provide finances for those who needed that to go into a recovery program. Typically, you find that your health insurance or your TennCare only pays for about a 30-day at Buffalo Valley or anything. They'll do a detox and everything, which is great. I mean, that's wonderful. But when you start to study the brain and the mind, you recognize that it takes anywhere from 12 to 14 months or longer to start getting circulation back in that prefrontal cortex. So you have people coming out, oh, they just did a 30-day program. They come back out, they go back home, and they're not thinking. And when you're not thinking, you're not making a decision, you're not making a choice, you follow the flow of people. And when the community hasn't changed, how are these others going to change? We're interconnected. We're working together. God has put us here as a human family, and we have an opportunity to serve and minister to each other. And as I was doing that, Dave's like, you need to go and get your peer recovery training. And so it's free in the state of Tennessee. It's 40 hours. It takes about a week. You go for training 8 hours a day. They'll provide that, but then you need to provide your own housing and food when you're down there. And then you have a 70 hours that you have to participate in ministering to your community. And then you have like a nurse practitioner or a doctor or somebody overseeing that. And then you're able to get your certification. And through that, they've even found that they are hiring peer recovery specialists in the emergency rooms. They're hiring them in different facilities. They're opening up peer support centers. I mean, this is becoming very effective in being able to reach out, especially those who come in just from an overdose into the emergency room, having somebody there to minister and say, hey, they don't have the stigma. They're not looking at them like, what are you doing? No, it's, hey, I've been there. I can relate. And honestly, as Christians, you don't have to do what I've done, where I've had 9 years of addiction, 20 years of recovery. You don't have to go way out there to comprehend where I've been. Because when we stand at the foot of the cross, the ground's level. Because everyone has fallen short. We know what it's like to feel like our relationship with the Father has been severed because of sin. And so, as we come together, we can encourage each other and strengthen each other. And this is not just addiction for the peer recovery specialist. I wanted to, what's his name? Twan, thank you. I was listening to what you were sharing. And peer recovery specialist also is not just addiction, but it's mental health. They've been hiring people to work in the different mental health facilities. And again, you need 2 years of recovery. So 2 years of being able to follow like a RAP plan, mental health plan or something, and being able to be stable in your recovery from addiction or mental health, and you'll be able to help facilitate with those around. So if you have members in your church who are strong and have overcome some of their issues, then you could tap into them to be able to get the free training that the state provides. Sister White says, if the money's there and there's no strings attached, use it. It's a tool to the glory of God. Thank you.
So I think it'd be awesome if every church had a certified peer recovery specialist there, to help get people. But there are other things a church can do, even if you don't have that. It might be a literature rack with pamphlets from different recovery centers, different recovery organizations. Maybe a list of all of the different recovery 12-step meetings and where they're located and what times they are. It could be something like that. But I do also want to share really quick how this has affected our evangelism. I've heard people say, well, how do you turn this into evangelism? You're just kind of doing all this stuff for these people struggling with addiction. How do you turn that into evangelism? We've started going door to door. We do a survey, door to door. In that survey, we ask people, what's the biggest need in this community? And we go through, and everybody says the same thing. Everybody says it's addiction, because it's huge up there. It's huge. So we already know what the answer is going to be. But in that process, we'll ask them, well, have you heard about GRACE, the Grundy Recovery Alliance Community Endeavor? And then we'll hand them something like this or some other piece of literature. And what it does is it shows that, we're not just in it for ourselves. We're not just here trying to push something. We're here to help the community. We're a part of this organization. We are working with it, and we want to help people. And so we'll give them something like this, and then we'll offer them, say, well, one of the things that our church is doing is we're seeking to help people. Actually, in the survey itself, we asked, do you believe that the Bible holds the answers to addiction and recovery? Almost everyone up there will say, yes, we believe the Bible holds the answers. Well, we are trying to do our part in this, and we'll hand them a Bible study. There's a set of studies, only 6 studies in it. It's called Peace and Inside Job. You can get it right over here at the Adventist Book Center. It's called Peace and Inside Job. And so we'll start them on those Peace and Inside Job Bible studies. And it's just the basics of the gospel in that study. When they're done with that, if they still want to continue with studies, then you can continue on with some other type of Bible study. But we found that with that survey and with those studies, we have not had a single person turn down the Bible study.
Amen.
I mean, that 100%. I mean, that's pretty amazing. Any of you had that kind of record with handing out Bibles? 100% of people will take them? Not usually. But what it is we've tied it in to the recovery work in the community, and it has made a huge difference. Now, the only problem is then you got to follow up with them, and if every single person is accepting them, you don't get very far down the street, But it's been a huge blessing, and we're looking forward to. We have a pastor in this conference who has his own addiction and recovery experience. He's also a powerful evangelist. We plan on bringing him up, hopefully within another year or so, up there to do a series. I've already got people I've been working with in recovery who I've been telling them about him. They're excited about him. Want to hear him give a message and that kind of thing. But anyhow. There's also ways you can personally get involved. I've had people in recovery working on my house. We get involved in their lives. You don't just leave them out there off by themselves. You pull them in. It's about discipleship. And it's about becoming friends with them. So, anyhow.
We have a meeting planned at Chattanooga Church, March 16. Could you kind of tell them, in other words, if you're interested in this program and you've got somebody, could maybe comment on that?
Yes, on March 16, we will be having a program, how your church can become a community recovery center. It may not look exactly like what we're doing. I mean, we're going kind of all out. We've got a lot of other churches involved with the project. But there are numerous ways that you can take your church and turn it into a beacon of hope and light for people who are struggling. That's what we're supposed to be, isn't it? So anyhow, I would encourage you, come out on the 16th to that meeting. Now that's going to be held, isn't that at Chattanooga First?
3 o'clock, 6 o'clock.
From 3 till 6 o'clock. We're also going to have someone out here from the state, Dave Hodges, the guy that she was mentioning earlier. He's over this region as well, and so if you wanted to get your church involved, he can help hook you up with local faith-based coalitions and materials, helpful materials. He can provide everything that you would need that direction. He's planning on being out here at that time too. Strongly encourage you to come out here. Come out for that. And like I said, the number of doors that have been opened in the community has been phenomenal. We've got the elected officials who have started attending our church. I think partly because of our involvement, in the community in that way. They see how much we're doing, and it's really opened a lot of doors. So.
Thank you very much, Jonathan. I hope we consider this seriously, folks. You heard what he said. Tremendous number of people out there are just lost. They don't know what to do for help. And Christ is the one that has the answer. And so here's a program that can reach them. So remember, if you have any interest, talk to your pastors. By the way, Jonathan has already met with the pastors regionally here. They understand the program. They know the program. The conference, ministerial people understand it. And so that's why their church is being chosen as a model for the state of Tennessee. Now, if you're in Georgia, which some of you are, on the left-hand side, you will see a sheet there just below where his was, or right before, and talking about, and it mentions the recovery program for Georgia with Frank Sanchez. And if you have any questions, you can call me on that, okay? All right, we're going to switch over now to get ready to talk about we've been talking about diabetes for a few years and so forth. Well, we're going to talk now about the Alzheimer's situation. Dr. Wes Youngberg has been working in this field for over 30 years. You've got a sheet, right there it is. You can read all the details. It's interesting, he calls it the reversing cognitive design. And if you're like me, I had to look up the word to see what cognitive meant. and it refers to, if I can get and you can see it right there in front of you, but it's recovery that is dealing with the process of things like memory, perception, judgment, and reasoning powers of the brain, and comparing that to emotional problems that Tuan was talking about, or mental, what we would call mental health situations. He has worked with Dr. Bredesen at the Cleveland, Ohio clinic. Dr. Bredesen has reversed over 100 cases. Dr. Youngberg has been doing these lectures all over the world. He has books and magazines and all kind of things. You can even find him on the internet. He will be at the Chattanooga First Church, July 20th, from 6 o'clock to 9 o'clock in the evening. Now remember, in the summer, the sun sets about 9 o'clock. After that, between 9 and 10, he will be answering questions, and they will be selling books and some other things, okay? What we're going to do today is show you just the first part of two different people that he uses as examples that have gone through recovery. Now, you may notice it talks about prevention, but if you read in the fine words there below it, he is talking about prevention, but even recovering. And you're going to see an example of a case where this has happened. Dr. Youngberg told me that the Alzheimer's situation is about where type 2 diabetes was 20 years ago, where people said that cannot be reversed. We know it is happening right now in diabetes. So if we're ready, I believe we're going to start this video now. And are we ready? I guess we'll turn off the lights and see.
We're glad to invite all of you and have you be here and attend to this special program with Dr. Wes Youngberg, lifestyle medicine specialist up in Temecula, California, where he practices.
A portion there's quite a bit more. He eventually, and if you come in July 20, you'll hear him talk about at least two cases But basically, you got the idea of what he's talking about. It's a number of different approaches. One lady had 16 different things that she did. Another guy, it was like 23 things. Folks, we need your help on advertising for this. We have a team already that will be working on helping us as far as advertising. We will be able to send a sheet like you've got to you as a health leader, but we cannot run off sheets for the whole conference. So I hope you understand that. We're going to have some people that are contacting doctors in Chattanooga, doctors' offices, people like Marlene that was here, or Deborah Talby at college at Chattanooga First. That's her. She works in the field of advertising and reaching people. But we're going to need the message to every church member in our churches, and of course in the city of Chattanooga or anywhere else. So we will be giving you more information in a couple of weeks, but be thinking about this. Make sure it's on your calendar, July 20th, from 3 o'clock to 6 o'clock. Okay, we're going to close up here in just a moment. The people that are health leaders, this is a magazine, for example, that you can order a lot of supplies from, like you saw out on the table. The one that I have there with the one that you see where the cholesterol, the clogged arteries, that gets a lot of attention. You can get things through, it's healthedco.com. And then there's a lot of other things. So we've covered a lot this afternoon. I would suggest, as I mentioned at the beginning, if you're a health leader, I would take this form and meet with your committee or whoever's helping you and go through all the details, see if there's things there that can help you. The same thing with personal ministries leaders. If you should have a committee, or at least people that are helping you. Just go through and see if there's other things that might help you. Practical suggestions. It is critical at the very back on both cases. You can see in health, this tan sheet has a number of resources. Advent Source is huge, but you can see a lot of things there. And of course, this is from Advent Source. And then on the personal ministry side, you've got the same thing. You've got this magazine right here, and then I think it's a gray sheet that's right before that. If you are just starting out or whatever, make sure health leaders pick up one of these. It's a quick start guide to things we've talked about, and you can pick up one of these. And this one is personal ministries. Okay, all right. We're going to be going off film here in just a few minutes, and like I said, we're going to now have our drawing. After I have the prayer, then he will stop the video, and then we will finish up our discussion of the things up here. So let's bow our heads for prayer. Father in heaven, we thank you again for the wonderful bodies that you've given us. We thank you for the mind that you've given us. We thank you for the call to spread your gospel and for your love. And Lord, as we've just looked at a number of different ideas this afternoon, different kinds of ways to reach out to not only our church members, but to the communities. Things dealing with diet and exercise and all the other different things that we've talked about. So I ask that you'll bless our leaders as they take a look at what can work and what needs to work in their church. We can't do everything, Lord, but we need you to show us what's the most effective thing we can do in our individual church. So I ask that you'll bless everybody as they leave, as they can get back home safely, and that you will continue to bless them by pouring out your Spirit upon the leaders, their committees, and their church. We thank you for loving us in Jesus' name. Amen.